So today I thought I'd talk about the strengths-based perspective and why I think it's so important to social work. So with the strengths perspective, I think the first thing I was going to say is around when we're completing assessments. When I was in my first year of employment, I had a really good supervisor, and he talked to me about when we're actually setting out to do the assessment, it's really good to talk about the person's background and find out a bit about them before we go straight into the needs part of the assessment. And I think that's really important, and I can see how a biographical and narrative approach comes into that. So in terms of a biographical approach, that means what makes the person who they are. So looking at their background and their upbringing and things like that. It depends on what the person wants to tell you, but the narrative approach to it means that you're doing it through conversation and talking. What that actually means is we're asking the person to tell us what they want to tell us about what makes them who they are. And I think that that's really important as part of taking a strengths-based approach, because people, especially that have been through a system, can often feel that only the bad points about them have been looked at, or they've not even been treated like a human being. So there was one lady that stands out to me in my mind because she didn't want to talk to any professionals at all. And I was told before I met her that she was sort of non-verbal and labels like that, and they were saying that she's just not wanted to talk to anyone, she's sat off in a room. So I had all these things in my mind, but I thought, well, I'll go and try anyway. And I went to have a conversation with her, and I didn't sort of push myself on her or force her to talk to me. I just said, who I was and that I was here and that I wanted to support her if I could. And we ended up having a really interesting discussion about what had happened to her previously. Everything that people had told me wasn't really true. She just said that she felt like she'd been treated like she was just a number in hospital, and she'd given up talking to people because she just felt that it didn't really matter. No one cared about who she was. They just saw a diagnosis. And she had personality disorder on her background as well. And she just said that she needed the help at the time in the past, but now she's got this label and everyone prejudges her. And I thought that really shows the importance of looking through and past people's labels, and that's a big part of the strengths perspective. So not pathologizing the individual, but looking at their identity of what makes them who they are and what's important to them. So I was able to see very quickly that she was someone that had been in university when she was younger, and she published research, but she had to go out of teaching because of things that were going on in her life. So that was actually a big part of her identity. Like, she was an intelligent person, but people were treating her in a way like she wasn't. And you can see how that would put up barriers, and people wouldn't be in a position where they'd want to trust the professionals because of the way they're being treated. But over and over again, I have seen the importance of looking at the individual and taking the strengths perspective. So another aspect to it, other than not just looking at people's labels and looking past that and seeing the person, is also, if the person can't tell you who they are, then it's your role to find out. So with this, I'm really thinking about people with dementia and people maybe who have some cognitive difficulties or reasons why they can't tell you. So I know that I was working with a lady, and she had previously been a cleaner, and she was currently in a care home, and they said that they couldn't manage her behaviours because she was just tapping all the time and always seeming preoccupied, and she was causing problems for the other people in the care home. So I asked quite a lot of questions around it and found out exactly what it was that she was doing, rather than just jumping in and thinking, labelling that behaviour and saying, what everyone was saying around her being disruptive and things like that. It's why is she acting that way? So because she'd been a cleaner before, I thought, well, I've heard that it's worked before, that if you give people support to actually do the things that they previously did, it can help people. So I suggested that they give her a cloth and involve her in some of the daily activities of like cleaning and things like that. Anyway, a few days later, they said that she's happier than ever. She was really settled in, and she's now doing quite a lot of the dusting and things like that. And the staff were laughing because they said they feel bad because she's not being paid for this. But I said, like, that is such a good thing, because she might not be able to process that herself, but like a subconscious, like she knows that she's used to those routines, and that's obviously what she remembers, which will be really important for like her whole sense of self. So that's just another example. And then I also thought about how people can often be written off. People, especially with disabilities, I've noticed that there's a real emphasis sometimes placed on no risks, like people can't be put at risk at all. And it's something you have to really like think about and just be aware of all the time, because part of being a human being is taking risks, because we never know what's exactly going to happen. And just because someone's got a disability, we shouldn't attribute that to the fact that they can't do things. So that might be, I've seen this played out in terms of people having relationships and then professionals automatically assuming that they're being exploited. And that's obviously that can happen, but it shouldn't be like our initial thought that it's definitely going to be a negative relationship, because that's not helpful for the person, and it means that people probably won't even want to share that information with the professional if that's the response they're going to get. And that can be negative, because then they might not get the same advice and support that other people would have. So I've supported people to make sure that they're aware of contraception, going to the sexual health clinic, making sure their health is okay, talking about what makes a good relationship and looking out for the signs of that. But you can only get into those conversations if you've created a space where the person feels that you're really listening and being respectful, and that you're not just going to label them. Yeah, I just think in every way it's not just lip service to like, well, I'm taking a strengths space, it's everything. It's really looking at equality and what's important. So on a basic level, the strengths perspective means that we're looking at what resources the person already has, so their networks and things like that, and also what the person's good at and what their aspirations are. So yeah, I think that that's just a few examples of why I think a strengths perspective is so important. It links with things like resilience and empowerment. And I always remember what Ali Gardner, a lecturer, said to me, that we don't empower people, they empower themselves. And I think it's just so important to think about really drawing out of the person what they're good at, what their strengths are, what is in their network, and looking at them as a unique individual and looking past the labels. Sometimes that can be hard when you're working in a structure where these labels actually help people to get services. But I think it's just being very careful that we don't let that infiltrate our practice and the way we use language, and that we're very careful to observe when that's happening, to make sure that we're the best place to help the person. If you enjoyed the video, please can you like and subscribe and press the bell if you'd like to be updated when I put out more videos. Thank you.